Hey Khaled, how are you? Oh, I can see I'm cutting
Good.
off my head. Just a sec. There we go. That should work.
How's your day going?
It's busy. It's busy.
Busy.
Lots, yes. Lots of
Sounds like-
changes, lots of updates, lots of speculation on what's coming.
Okay, let's talk about all that.
And of course, I got the numbers hot
Okay,
off the
cool. We'll get
press
to that
just for
in a
you.
second.
Okay.
Okay, awesome. So let me ask you this: Friday, Easter weekend, Good Friday. Are we going to go into some stay-at-home order, some another lockdown of some sort? Because we are in a lockdown now. But so what's
So,
going to happen this
so
weekend?
the answer to that is we don't know yet.
Okay.
But I've been warning you for a few weeks that there was a potential if numbers would grow exponentially, and they certainly have been. We've been growing about 20% a week. What was it? It was the week, first week, March 7th to 13th, we were at 78 cases per 100,000. So the first week of March, we were at 63. Remember, in the end of February, the beginning of March, I was still advocating for red zone.
Yeah.
And from it went from 63 to 73 to 78. Then last week to 97 cases per 100,000. And today, 111.
So we're not going to red zone anytime soon then.
No, 111 in Mississauga. Brampton's 227.
Wow. Okay.
227 cases per 100,000. That's pretty significant. And frankly, even Caledon, their case counts are very high. 145 per 100,000. They're higher than we are in Caledon.
So if what is your gut telling you? Do you see us in? I mean, it sounds strange because we already are in a lockdown. We are in gray zone right now. So
And we've
I guess
never
the
come
next
out of it. We haven't really been out of it since November. We've been
yeah.
operating with restrictive conditions since November. Yeah, November 22nd for sure.
I was reading that we have been the most locked down region
We've
in
been in the
all.
region most locked down, all of Canada, all of North America, because they didn't have the kind of lockdowns we have here in the US. So for
Yeah.
certainly true. So, you know, I think changes could be made, whether they look at keeping kids on their April spring break a little longer. We just open outdoor training, outdoor facilities. I don't see us closing those because, of course, we know that it's safer to be outside when you're outside. The one thing I would be concerned about at this point is outdoor patios, again, fairly safe because they're outside, is the personal care providers. That was scheduled to open April 12th. That may get delayed a week or two until we can get a handle on this. Because once again, this virus, and these are, of course, the new variants controlling us. We all
So
have the new variants now. It was just Mississauga that had the Brazilian and the UK and the South African, and Brampton does as well.
so Mayor Crombie, you just brought up something that I wasn't going to ask, but you brought up an extension of the April break. Do you think that's going to happen?
So when you and I speak candidly, everyone gets worried because they think I know something. And then it gets reported in all kinds of news media, as Bonnie Crombie said. Bonnie Crombie, you and I, Khaled, are having a conversation, and I'm speculating what could happen. What would I do if it were,
Yeah.
if it were in my hands? And I'm speculating that the premier is looking at a whole bunch of options. How are we going to get this virus under control again? What are certain mitigating measures that could be taken? I remember, was it 2 weeks ago, it was reported that I was saying we were going into lockdown. I was speculating with you that it could be an outcome if this very situation occurred. So
Yeah.
if I were the premier right now, I would be thinking about, all right, we just opened up outdoor patios and outdoor recreation and training, outdoor activities, which is fairly safe, all right? But what could we do? What other measures could be put in place so that we could get control of the virus again? And would you keep schools closed another week or two? That would be one idea, right? Would you wait another week or two before opening personal care providers? I know everyone I know has a hair appointment booked on the 12th and the 13th. So
I
it's
don't.
very disappointing, right? It's very
Yeah.
disappointing. And to them, of course, naturally, but for everyone who want to move on with their lives. And people do have, personal care needs they want to get attended to as well. So
I'm going to say, Mayor Crombie, I'm sure you know a little bit more than most people, so that's
I'm
why I
spec
am.
I have to say I am speculating, and I'm just empathizing, and I'm putting myself in the premier's position. What are my options? If I were the premier, what are my options? And I would have to say I wouldn't close down outdoor activities because I think it's fairly safe outdoors as long as we take the proper protocols are in place. But you would be looking at what other measures could be in place.
So let's talk about outdoor fitness, because that's supposed to open is it the 12th?
No, outdoor fitness is open now.
Oh, okay, sorry.
This week, it's personal care providers.
Okay.
Personal care providers that were to open on the 12th. I know I haven't signed up this week I've been getting all the text messages for Drew and Lish over at F45, and they're saying, when are you coming? When are you coming? We're going to be training outside. Sign up, sign up. So I have to do that yet. I have not done that yet, but I will, because it's very, very important. And I think we're opening Brampton this weekend as well, and I might go see how that looks on Saturday. And Lakeview was to open the following week. So safe outdoor activities. You can even play with your own family, because you can only share a cart with members of your own family, right? People you live with. Okay. Those are the rules. So, those are safe activities because they're outdoors. And then the personal care providers is what we were looking at for the 12th. And there was no plan yet to allow indoor dining. That wasn't in the cards yet. Okay.
Let's talk about hospitalizations. I know you got them fresh off the printer?
Yes. Shoot.
What?
Well, I have it. I just haven't been printed. Okay, let me just tell you off the top of my head. No, let me tell you off the top of my head. So what we know is there are 30-year-olds who are being hospitalized because these new viruses are attacking younger people. The symptoms are more severe and causing them to be hospitalized. So we know that Trillium Health Partners has about 50 to 60, I think it's 60 this week, hospitalizations and about 15 people in the ICU. That's pretty significant. I think William Osler over in Brampton is double those numbers. Those numbers. As I recall, I heard that they're on track to be, having if the provincial modeling bears out, on track to be having the most cases hospitalized and most cases of COVID, not only in the region, not only in the province.
Okay.
It's something we need to get a handle on.
With the confusion of gray zone, lockdown, things opening back up, off the top of your head, do you know what we're allowed to do in gray zone right now? Because people keep on asking me.
Well, it's easier to tell them what they can't do, right?
Okay, let's talk about what they can.
That's easier. So indoor dining is restricted, correct? Okay. And personal care services is not open, not allowed yet either. Because anything that's going to come in, anything where you're going to be face to face with another person for a long period of time is not permitted, or direct contact with someone's face. So certainly, having your hair done or your makeup or spa treatments, that sort of thing. Even nail salons. We know that they were a cause of spread in the Kingston area. There were 13 cases in Kingston as a result of a nail salon. So those are the things that are not open. And I think pretty much else is, even though modified with restrictions, but permitted.
Okay. And then is the city going to open up outdoor kind of fitness classes? The city of Mississauga? Yes,
I believe we are. And also camps. We will be hosting camps for spring, I think on March break, spring break, let's call it. And also in the summer, we can register. And unless things change and we go into that stay home lockdown, because I guess even gray zone is locked down now, but without that will be permitted and it'll be outdoor. Mm-hmm.
Okay. And I know you're speculating, but the question we got asked 4 times is on April 12th, when home care and salons are allowed to open. Do you see that being rolled back?
Rolled back. So right now the plan is to open. Right now the plan is to open with capacity limits, and I believe it's a maximum of 5 people, even in the large salons. It could be postponed. It could, hypothetically, if things don't improve or get worse, yes, it could get pushed back. Yeah.
Okay. Let's talk about the vaccinations. Let's talk about AstraZeneca. Obviously, a lot of
confusion. I'd say confusion. Yeah. So certainly initially it wasn't safe for anyone over 65. So we were vaccinating people 60 to 64. Then studies proved it was safe for everybody over 60. So we opened those doors up to over 60. And then we said, no, it's safe for everyone. but we were only vaccinating 60 up, and then suddenly it wasn't safe for anyone under 55, particularly if you were a woman of childbearing age, because they seem to form blood clots. So there has been a lot of information. I just say I think it's safe. I think all the vaccines are safe, and so we'll wait and get a little bit more information. There will not bring vaccines on the market that are unsafe for people. That said, the AstraZeneca is only available in pharmacies in Toronto, Kingston, and Windsor right now, or in doctors' offices that are part of the primary care provider, and there are only 8 of those. And they were not given many doses. So they shared, I want to say, 4,500 doses between 8 offices. It was under 500 doses, 450 doses or so each. It wasn't a lot. It wasn't very many. And I know that they'll open up the pharmacy pilot to us because there is AstraZeneca arriving this week. We just don't know when that is. I'm hearing it could be as soon as this week or early next. And then they will expand the pilot program to Peel region, so to Mississauga. And I understand the agreements that there are pharmacies that are reading through comprehensive agreements that need to be signed with the province, etc. So we know of those, and I know that the doctors, the primary care providers, are also very eager that program, that pilot, be expanded so that it's offered in more doctors' offices. I know many, and it stands to reason that people feel more comfortable going to their very own physician for advice. Is this one safe for me? Which one's safe for me? Which one do you recommend? You have this one, is it appropriate? To get that vaccine from their own personal doctor. So that does stand to reason. So it would be good to expand the personal care provider pilot project as well. And the pharmacy pilot, just so convenient to, register and walk in when it's your turn.
But so we've talked to Peel Public Health, and there are, still vaccine appointments available for, the day of or tomorrow. Why do you think there's so much open spaces?
Well, so that's a good question. I mean, when they increased the age, the word wasn't communicated quickly enough so that the next day and the following day there were still appointments open. But certainly people are moving through very quickly. At first, it was a question of supply. Do we have the supply? Now we seem to have the supply. Now we need to get the word out, just register, come in. And I know we had a glitch last weekend at some of the mass vaccination sites that we didn't have enough staff and people were lining up. But we've got that all sorted out. It was a good problem to have that we had a lot of demand, but that was sorted out. And so people won't be waiting in long lines anymore. And in fact, they've been telling them just wait in your car and you'll get the word when it's your turn. And Trillium Health Partners, it's pretty steady flow going into UTM, the one that they're managing as well. They've done an exceptional job as well. So, I'm very confident in our 5 mass vaccination sites. And, we did vaccinate all the 80 plus that were living in congregate settings in long-term care homes and seniors homes. So we were just vaccinating 80 plus that were living independently at home. And it could be that we've, vaccinated all those wishing to receive their vaccine at this point. And then we're now at 75 plus and soon to be at 70 plus.
True. Okay. You said, I'm sure you've seen the Wonderland Drivethru vaccination center. Is Mississauga going to get a drive-through?
Yeah, so we talk about this, and it is an option. I mean, we were the problem always here in Peel was that there was a shortage of supply. But now they have seemed to rectify that issue, and more has come in. And I was on a call with Dr. Dirk Heyer, who is on the vaccine rollout roundtable, and he says, oh yes, we're getting it out as soon as possible. And that is an option for us. If you want to do yours by drive-through at the Paramount Fine Food Center or wherever. And more importantly, mobile units, I think, are worthwhile so that we can get that vaccine right to seniors who need them, who live in congregate settings, who haven't yet been vaccinated, or those who are homebound, right, who don't have the same sort of ability to go out to the vaccination sites. And maybe don't have anyone to bring them, and maybe aren't comfortable calling Wheel-Trans, because of course you can call Wheel-Trans and they'll pick you up. They need 48 hours notice, and then they'll take you to the mass vaccination site. They'll wait for you and bring you back home. So that is an option, but there are many seniors who are homebound, and this would be another way to provide them with the vaccine if we could have some doctors that are willing to make house calls. Once again, remember those, Khaled? House calls.
I remember the milkman. That's
You're too young. You're too young. There were house calls when I was young and I was a child.
I remember the milkman.
Do you really?
Came,
Were they in glass jars, milk in glass jars? Because I remember those.
I remember that too. So I'm old. So so let's talk. Do you think Peel and Mississauga and Brampton are getting their fair share of vaccines now?
Yes, now things have really turned around. I mean, there was a time where I was quite vocal that I didn't feel that we had received even our fair allocation by population, that we were under the provincial average. And then that changed that week. That week, we went from having 7% of the vaccine being 10% of the population to 9%, and now that's even improved. But certainly Mayor Brown and I and our councils have made a case for what we call an ethical framework, because we're 20% of all COVID cases. Shouldn't we then be receiving 20% of the vaccine? Because at the end of the day, we're not going to stop this virus from spreading unless we stop it in the hot zones, which is right here. So this is where you want to deliver the bulk of the vaccine. It's terrific. I understand people in Kingston would like to have their share of the vaccine, but they are in the green zone. They have very, very few cases. This is where the density is. This is where the people live. This is where the jobs are. This is the intensification area. So this is where we need the vaccine to stop this virus from spreading.
Let's talk about vaccine wastage. If the appointments do not get booked, what happens to the vaccines? And could there be like a lineup?
Wait list?
Yeah,
a wait list. So certainly there is. We do have wait lists of groups that are, kind of next in line. I would say like our police officers, police service, Peel Police, HU drivers, educators, etc. But we're having very little wastage. They assure me, we've had these conversations with Dr. Lowe. It's all balanced out by the number of appointments, because of course you have to separate out in the little vial that it comes in into the syringes. And so we know how many people are booked, and that's how many syringes they fill for that day. So we have very little. However, we have discussed the idea of a wait list or a group to call in should there be, some cancellations that day and they find themselves with some extra vaccine. Then certainly here's who we can call to bring them in quickly if you can give them a couple hours heads up. And people are asked when they make their appointment if they have flexibility. Could you come at a moment's notice? Could you come if there's a cancellation? And those people that say yes, they can, then they're invited back. But I have to say that we have been very good. There hasn't been the kind of wasted vaccine that I've heard about in other regions.
Okay. I know General Hillier said again today, everybody by June 20th. Do you believe that?
It depends on the supply of vaccine. I mean, certainly. Pardon me?
If we have the supply.
If we have the supply, it's absolutely doable. I mean, we can do 20,000 people a day, if not more, if we have the proper vaccine and we have, 5 sites up and running in Mississauga alone.
True.
Right? So we could. But we need to.
Oh, I was just going to say, so who can get vaccinated now? Because I think Halton and York said 60 plus still?
60. They're moving to 65, I think, this week.
This week, okay.
And we usually follow shortly thereafter. Let's be fair that we're a much larger city. We have more people in each of those age categories. We had more essential workers to vaccinate, more frontline healthcare workers. They were moving through the system a little faster than we were. Dr. Lowe feels very strongly that the people in those age cohorts should be given every appointment first before we open it up to another cohort. But we argue that just to prevent there being those lapses in appointments or any wastage, we should open it up just in case. And he agreed that we can do that. So we are as well at 70 plus, correct? And they are moving very soon to 65 plus, which means we we should be moving in that direction fairly soon as well. We're usually not far behind. We just have more people, right?
Yeah, true. Okay, let's get to some viewers' questions here. You already answered the first one. Is the region of Peel considering offering leftover doses to others to what TO did? You already answered that.
Of course, yes. We don't want any waste.
Oh, here's one. Is the city of Mississauga hiring for summer jobs like usual?
That's a good question. That I don't know. I do remember a couple of intern positions that crossed my desk, but I don't think those were summer. You know what, Cal? Let me get back to you. Remind me for next week, and I'll have staff who are listening. I should check my phone.
Okay.
They'll text me a message instantly. Oh yeah. Oh yes. Oh yes, they do.
Okay, so and here's one that you touched on. Maybe what are you doing about the long wait times for vaccines for elderly at the Paramount location?
Yeah, that's been resolved.
Okay.
So we did have a little bit of a glitch because, you know, we were operating with the number of vaccine supply that we had, and it was relatively constant. And then all of a sudden the big shipment came in and we weren't quite staffed up enough. And so now that situation has been resolved and it's under control, and it's very smooth and very seamless. And very, very proud of the work that Dr. Lowe and his team have done, and very proud of Michelle de Manuel and the work that they've done, Trillium Health Partners, who manage the UTM site,
Sure.
right? Because they're running the vaccine center at UTM, and Peel Public Health are operating the other 4. I mean, it was it was a good problem to have, but nonetheless, it was a problem we solved very quickly, as we saw that there were people waiting in line, and it was a cold day-ish. Unlike today, it's beautiful, but I think the day they were waiting was rainy and chilly.
Oh, okay. What's the likelihood of barbershops won't be opening on April 12th? I think you've already answered that.
Like this, fingers crossed, right?
Yeah. What proof would you need to go to the second phase for essential workers to be covered for a vaccination?
What proof?
What proof? Yeah, so, I guess if you're a grocery store worker or a restaurant worker.
Right. So yes. So anyone who can't work from home is in phase 2, but I don't think we get to them. I mean, technically we weren't supposed to get to them to June, but things are moving much faster. So, I mean, it is April this week, right? I wouldn't be surprised if we get to them, right? I wouldn't be surprised if we got to all those essential workers who can't work from home. And those are, of course, so even our educators, our teachers, our transit drivers, our grocery store workers, etc. Everyone who can't work from home will be in phase 2, and probably as soon as, I don't like to speculate because the charts have it in June, but I bet it'll be May when we get to them. So very soon. And of course, if they meet one of the age cohorts or they have underlying health conditions, they can get in sooner. Mm-hmm.
And here's a fun question. What's your most hated outdoor workout at F45?
Natasha, what do we hate to do when you have to fall down?
Oh, she there?
Yes. Burpees.
Oh. Burpees, okay. Yeah. Oh, yeah. Awesome.
Burpees and burpees. Oh my gosh. And Drew's brutal with the burpees.
Okay, there you have it.
Burpees, push-ups, and then planking. Oh. Oh, and then I did have a sore back because I had to do kettlebells. I did them on my own and no one to correct me. Natasha wasn't home that day, and I wasn't online with Drew and Lish and the gang, and I did hurt my back. So it's been about 2 weeks I've been out, but I'm back. I'm back now. I'm coming back. Okay. Burpees. No one loves it. It's going to
be the most hated Mayor Crombie workout. That's next.
Yeah, that's what he's getting. Now he's going to name it that too. I can just wait. Okay, here we go. The boot camp by Bonnie. Burpee down.
That's all the questions I have. Is there anything else you want to bring up? We're actually 6 minutes early.
No, we should fill it because you know I know people love to listen. I know my mother is probably online. Hi, Mom. We're going to get you your vaccine very soon. As soon as my number's called, I'm bringing you too. We're going to go together. And no, she wants to go with me.
Okay.
She wants to go along with me, so when my number's called, I'll get the vaccine. We'll do it together. I'll book double appointment for her and for me. We'll do it together. I'll hold her hand and she'll hold mine.
I do have another vaccine question, though.
Sure.
I told you last week my mom got her vaccine done, but July 5th is her next shot.
I know.
Right?
So they're talking about that, whether they can narrow the window once again. But again, that's based on supply, right?
Yeah.
4 months is safe, no problem, to extend the second dosage for 4 months. But again, if we have supply, then I'm sure they'll start calling people in sooner, whatever the time allows. This is a holiday weekend. We should remind people that it's Easter, Passover was last weekend, and that we want people to practice very safe holiday practices, which is celebrate only with your immediate family, celebrate online, and case numbers are increasing, not decreasing. So this is not the time to relax your protocols. So please, it's nice to have Easter dinner. I know people have different traditions, whether they have turkey or lamb or ham, whatever they do. Please, you have to have a smaller one this year. And I'm very confident that by the time we get to Thanksgiving and to Christmas, you'll be celebrating again all together with your family. As long as everyone's been vaccinated, we can start to gather again. But this is yet one more holiday, and this will be our second Easter, right? That we are in lockdown and we are not able to celebrate with our extended families. And that's very important, because those gatherings, family gatherings, large extended family gatherings or social gatherings, people joining other families for these big holiday traditions, is what drives our numbers. Because community spread, household spread, and social gatherings are still the largest drivers of our COVID cases. I mean, workplaces, yes, but that's a much smaller percentage. Workplaces are still under 10%. The largest numbers are still household and community spread, and the bulk of that is gatherings, social gatherings. So please remember that. We don't want to be, we almost normalize this lockdown situation here in Peel and in Toronto. We've got to get out of this lockdown. We want to start reopening. Everyone wants to. But if people start to gather for the holiday season, and Easter is this weekend, it will drive numbers, and we can see it. We'll see it right on the charts that we get in. We'll see the hospitalizations increase, and very, very sadly, it is 30-year-olds, 40-year-olds, 50-year-olds that are being hospitalized for COVID, and in the ICU, and we didn't see that before. The only good news is that we are not seeing people from long-term care homes and seniors' homes in the ICU like we did in the first wave, because those people have been vaccinated and they're safe now. But the new strains are targeting much younger people, and they're much more severe, and you get sick faster and more severe. And we've seen only these young people in some very serious situations in hospital. So please, it's just not safe yet.
And I got one favor to ask you, Mayor Crombie, if you don't mind. My Lola is turning 101 next month.
Oh my goodness!
Yeah, she's in a home, and she watches you. She watches TV all the time, and she watches too much news, to be honest with you. So she knows everybody's faces. She knows your face. She knows Andrea, Doug, everybody, right? So can you say happy birthday to her so I could just clip it and so I could send it to her?
100?
101.
101. Oh my goodness. Lola, it's Bonnie Crombie, Mayor of the City of Mississauga. On behalf of my council and my entire city, we want to wish you a happy 101st birthday, Lola. We love you. Stay well, stay healthy, and I'm so happy that you've been vaccinated. Happy birthday, Lola.
That will make her day. Thank you so much.
Oh, my pleasure. She's older than Hazel. My goodness.
Yeah,
that's fantastic.
She's a huge fan of Hazel too. So,
wow.
and you as well. So.
Thank you so much. Happy birthday, Lola.
All right, Mayor Crombie, thank you so much.
Thank you. Bye-bye.
Okay, bye.